Hi, my name is Dr. Jeremy Heidt, and today I wanted to discuss hip pain. Hip pain is a very common condition that we see in our clinic. We often see patients that are having trouble sleeping. If we lay on that side, we actually compress part of the tissue in our hip and we can actually slow down the blood flow. So we see patients waking up in pain in the middle of the night or unable to sleep on that side, so they have to flip over. Pain going up and down stairs, pain with walking, pain with running. We also see a lot of patients that are just having a tough time getting on the floor with their grandkids and playing with them. So the big thing with hip pain is, number one, we want to make sure we know exactly what is causing the pain and what tissue is being irritated. So the first thing we look at is we take a look at the joint capsule. There's a couple easy range of motion exercises and orthopedic tests that we can do to kind of rule in, rule out, is the pain coming from that hip capsule? The second area that we want to look at is it coming from our lower back? We have nerves from our back that basically go and can innervate the hip and cause referral pain into that hip. So that's something that we do occasionally see, and there's a correlation there. The most common cause of lateral hip pain actually is a condition called gluteal tendinopathy. And basically what happens is we have these muscles in the hip called the glute medius and the glute minimus, and that tissue can get overstressed. So these muscles basically are a stabilizer of our lower back, but it also is a stabilizer of our lower extremities. So knee issues, ankle issues. If we have any issues in the ankles or the knees or that lower back, since this is a stabilizer, we actually get more force into that tissue, and over time it just leads to a strain. Can lead to pain, can lead to issues. So there's a lot that can be done with this. I'm going to kind of introduce one of the easy exercises and strengthening exercises that we can do. There's a lot that we can do in our clinic to go in there and just kind of clean out that tissue. And we also want to make sure that the load on that tissue, anytime we're seeing a tendinopathy, we basically have to get a patient on exercises to strengthen that tendon. And over time, it'll just develop, get stronger and stronger and stronger, and lead to having less pain for patients. Thank you.